So thank you all for being here. I am Dr. Cristina Gonzalez Alcala. I serve as the Director of Community Investment at Akron Community Foundation. It is my pleasure to welcome you all today. I want to take a moment to express our deep appreciation for those who make gatherings like this possible. To our board members in the room, if you can do a quick wave, please. Board members in the room, thank you, thank you. You can see already, a quick round of applause for our board members, thank you. To you, thank you for your leadership and trust. To our community investment team, please give a wave. Thank you for your heart, for your deep care of our community, and for always having my back. We also want to say a virtual hello to President and CEO John Garofalo. He's going to be turning into Facebook Live to watch us all. And so to begin this conversation, let me share something. So earlier this morning, I got myself to work out after not doing it for about 3 months. So yes, thank you so much. Appreciate that support. That's what I wanted to just period. We can move on now. So earlier this morning, as I was working out, I do a little iFit trainer on my app, and as I was, doing the biceps or whatever, he's like, you'll start to feel it burn. It's like, that's not pain. Those are your muscles growing, right? And so in that moment, I was reminded of the incredible power of framing. The words we use to describe a challenge can either shrink our sense of what's possible or open us up to growth. That's true of how we think about ourselves, and it's also true about how we think about housing. Too often, housing is viewed as a personal transaction, something tied to income or credit or market availability. Today, we're choosing a different frame. We're here to explore housing as a community infrastructure, just like roads, schools, and clean water. Something that supports our health, our dignity, and our ability to thrive. The Frameworks Institute reminds us that when we change the way we talk about housing, we make room for better solutions. Not just temporary fixes, but durable, coordinated efforts that recognize housing as a foundation for long-term well-being. And we see that clearly in the data. Summit County's own community health assessment, which I got a sneak peek from, and I won't take away from David's thunder. It identified housing as a priority and a priority driver of health. Once again, if you've been following our proactive grant making, that is a priority that we carried from our 2022 Community Needs Assessment. And also the Housing Research Collaborative's 2025 Summary Report, it gives us a clearer picture of why that matters. So let me highlight a few interesting things on that report. The median rent for a 2-bedroom apartment in Summit County rose by more than 40% in just 6 years. The median rent for a 2-bedroom apartment in Summit County rose by more than 40% in 6 years. More than 1,400 eviction cases were filed in Akron Municipal Court in the first half of 2023 alone. And the report calls for bold leadership, cross-sector partnerships, and new ways of thinking about housing systems. Not in isolation, but as part of a shared path of community health. So today is about strengthening the path together. We'll begin with a brief data presentation. Brief, right, David? Okay. Ish. Presentation from Summit County Public Health to ground us in local realities. Then we'll hear from a panel of leaders working across housing, health policy, and justice. Our panelists today are David McCartney, Summit County Public Health. We have Andrew Newhouser from Community Legal Aid. Herman Hill from Akron Metropolitan Housing Authority. Latoya Harris, County of Summit, Council Member, Jeff Wilhite, and Jada Moore from Continuum of Care. So together, they'll help us explore where systems are working, where people are falling through the cracks still, and what's possible when we align our work with our shared vision. Thanks again for showing up today, not just as professionals, right, but as neighbors and partners in imagining a stronger, more equitable Summit County. With that, I'll turn it over to David. Thank you, David.
So as as Christina mentioned, we are in the process of about to release our community health assessment for 2025. That should be released within like the next week or two, and there will be mass information about that coming out from me, from everybody involved, and we'll make sure everybody gets a copy. So health is defined by the CDC as not just the absence of disease, but a dynamic state of physical, mental, and social well-being. And so when we look at health from the public health point of view for housing, it's not just are you healthy in your house, but is your house healthy as well? And I'll get into that a little bit. But social drivers of health, also known as the social determinants of health, have also impacted the way that health develops in a community, in an individual, and those are grouped into the 5 main categories of economic stability, education access, healthcare access and quality, neighborhood and built environment, and social and community context. So just a little bit about the history of inequity in Akron and Summit County as a whole. So most of you, I'm sure, are very familiar with redlining, and it's just an example of how structural racism still impacts housing and health today, and I'll get into that as we go forward. But also we need to recognize that the rubber city that we are also has a history of pollution with waterways and the air. So very briefly, I'm going to try not to be too data heavy on this, but it's a data presentation, so bear with me, please. The housing stock of Summit County, when we look at it, it's relatively older. Oh, this is the wrong one. This is the cost. Just kidding. Getting ahead of myself. So the average house, the median cost of a house in Summit County is around $171,000. When we look at the city of Akron, we see that that is much less. That's the white. So that's about $47,000 to $191,000. That pale green, it's supposed to be pale green, it may look white on the slide. But then we have the suburbs, and those, as you get out of the city of Akron, then housing becomes more expensive, up to where Hudson has the largest median cost of $130,000. When we look at the average age of housing units in Summit County as well, when we break them into census tracts, the low income census tracts, the housing aged 4 years. So our last CHA and data poll was about 3-4 years ago when we did that data poll. So that kind of tracks. The average age of housing units in high income census tracts decreased in that same time frame, from 63 to 61, which means that new development, new housing, removal of blight, is occurring in those high income areas, but it's not occurring in the low income areas. So on all these maps, all of the red squiggles are all of the areas that were historically redlined in Summit County. So keep that in mind when we're going through this presentation as well. So the median age of a house in Summit County is 65 years old. When we look within the city of Akron, it's above that median, with 83 as its median age. And that range goes from 75 years old to around 109, give or take a year or two. When we look at the suburbs outside of the city of Akron and the rest of Summit County, it's 55 is the average age of housing in that area, with a range of 32 years, usually to 79. It's not including brand new builds, but around that area. It's also important to recognize that 25% of houses built in Summit County were built before 1940, and 71% were built before 1970. And that's important to remember on a future slide, because that was the year that lead paint was banned. But Akron and Summit County still continues to have the risk of lead due to paint and pipes that are being replaced. All right, so this just goes through. So this is this poverty by 200% under the federal poverty line by census tracts. So census tracts are these tiny little areas where the census pulls data, determines populations that are roughly the same, and tries to group them together for data purposes in some capacity, not 100% sure, but that's how my understanding of it goes. When we look at the census tracts in the city of Akron, it's darker. So higher levels and concentrations of poverty within that. into the downtown area and as we move out. When we overlay the age of housing, it gets slightly darker. So again, that's just the poverty level. But when we do poverty level with the age of housing, it's the same map, showing that this isn't happening in the same areas, and that is where, unfortunately, we'll get to it. I'm getting ahead of myself again. So when we look at renting in Summit County, housing affordability and renting affordability is usually defined as spending 30% or less on your housing of your total income as an expenditure. Unfortunately, in Summit County, 46% of our renters are spending more than 30% on their rent. The average cost of a a fair market evaluation of a 2-bedroom apartment in Akron and Summit County is around $1,100, which means that for a person to spend 30% of their income on that to afford that, they need to be making $21.75 an hour, assuming that that is what they are doing for a 40-hour week. However, unfortunately, again, the average renter hourly wage is $17.36, so a gap of over $4, showing that, again, that's part of the issue with housing and renting in Summit County. And then the hours, if you're working minimum wage job, you would need to work 81 hours a week in order to afford that fair market rate apartment. This does this good. A second. Sorry.
I think it goes from just like we go on the next petition.
Why not? These are the forced pauses that life wants to give us. So take it in, pause, breathe in.
That gives everybody a chance to open up their snacks.
Yes.
In the movies.
Come on.
You're in a county facility, it's lowest and best bid.
Okay, all right. So then when we look at housing affordability, so moving on to people who own a house or have a mortgage, that definition still applies, that 30%. When we look at those who have a mortgage and are paying more than 30% of their income on housing, about 1 in 5 of Summit County homeowners are paying more than 30% of their their income on housing. It's interesting to look at the map because while that map looks like most of the other maps we've seen so far, where the concentration is in Akron, we also see the higher income areas for housing, if we go back a couple slides, such as Twinsburg, Macedonia, and Hudson, that those levels are also blue, showing that there are higher concentrations of people paying more than 30% of their income for their housing in those areas as well. Just kidding. That was actually renting. The blue is renting. The orange is home ownership. So scratch what I said and put it towards renting. In housing, this is the housing map that shows people paying more than 30%. So again, it's the same map that we've seen over and over again. When it comes to buying a house in Summit County, the average rate of mortgage denials in Summit County is about 6%. When we look at denial rates are higher in the Akron area, as seen here, and the home improvement loans also follow this track. It's the same map over and over again. Denials are lowest in the more affluent areas that we consider, such as Hudson and Richfield. When we look at, start to break that down a bit further, a racial disparity exists within home loan denials. So Black residents of Summit County were 3 times as likely to be denied a mortgage and 2 times as likely to be denied for a home improvement loan. So if we go back to the age and the quality of housing, poor conditions of those housing often leads to exposure of things that you don't want to have in your home or part of your health. So carbon monoxide, allergens, lead, physical damage that impacts your safety or the safety of your children, or it lacks basic facilities and utilities. That includes water, toilets, laundry. There's a decent amount of rental properties in Summit County. It's a different metric that I don't have on these slides, but it's included in the CHA that has that information on it. When we look at lead, of children tested for lead, so it's not all children, but of the children who are tested for lead, 11.8% of them test positive. This map here shows where a majority of those children reside. Again, does that map look familiar? However, Summit County Public Health has a lead abatement program that does abatements in those high concentration areas. So this map here shows you the hot spots that are the red and the orange areas, but then inside each of the little hexagons give you the number. I can pass these slides around after the presentation as well, so just throwing that out there. So we are doing the work, but there is more work to be done. So we look at health disparities, and this is just the basics. This is just a couple that we could easily pull readily. For poverty, life expectancy at birth in that zip code. So it's not your current life expectancy, it's your life expectancy at birth, because place matters. Premature births, overdose deaths, fast food purchases. This map is the same map for a lot of other things, including percent of people who do not have health insurance, smoking, social vulnerability index, which is a CDC metric based off of how vulnerable that population is for disaster, financially, economically, environmentally, and the COC's homeless population map as well. I pulled that before, so it's not.
Right before.
It's not.
Yes.
It's the same map.
It is.
So while all of this does sound depressing, there are good things happening in Summit County as well, such as the Summit Housing Research Collaborative and Right to Counsel. And so I'm sure those other panelists will speak about that. But I will take any questions you have, or are we saving those for the end?
If we have a quick one
Okay.
for you right now, anybody?
So you can either reach out to myself or to our chief epidemiologist, Rich. I am not an epidemiologist by trade, but you can also put in an epi-data request at our website, and that's how all of these maps were made. So that is a epi request. There's also the asset map on Summit County's website, where you can also create your own maps and overlay these same metrics and get the same information that you might need. Thank you.
Thank you so much, David. So with that, now we have our local realities. Let's get to hear from the local experts. I'm gonna start with LaToya. LaToya, you did work with the Housing Research Collaborative. Can you speak to that for us, please, so we can get going on that as well?
Well, good afternoon, everyone. I usually don't speak with the mic. I usually don't need one, but it's all right. First and foremost, it is wonderful that we can all come together and talk about housing and have these continuous conversations. Summit County Research Housing Collaborative was an initiative put forth by the county executive, Eileen Shapiro, and also executive director, Patrick Bravo of the Land Bank. And it came out of a necessity. It came out of all of the conversations and all of the tables that all of you have been at and continue to be at. When you think you know something and you act on it, it doesn't always work out the best way. But when you get those individuals who are actually doing the work, those individuals who are actually affected by the loss of housing or unsheltered, and you open a forum to bring their ideas, bring their concerns together, and give them a platform where they can be spoken, or they can speak and be listened to and heard, and retain this information, because you know that we are tired of talking and we need action. That's what the Collaborative Research Initiative started as. We started this initiative, we started talking about it last year around this time, around November. There were 14 sessions open to the public, and Metro was kind enough to say, if you printed the flyer, we would give you a free bus ride there and back if you needed it. We didn't want transportation to be a barrier to anyone who wanted to attend any of the sessions. But we had various topics, multiple topics, all leading to our housing system. So it was unsheltered, it was specialized groups that are affected by housing. It was safety. These various, and let me say before I forget, all of this information is on the county website, including all of those who participated in the steering committee, and all of the information in the final report that we have, and how everything was broken down. From those various topics, we retained about 315 responses. Out of those responses, I believe 128, more than one individual was talking about, or I think it was more than 3 individuals was talking about specific topics in that 315. And our consultant, Matt Devers, was able to whittle all of that information down to 3 categories. A commitment to leadership. I can remember.
Crescent comparatives.
I got it right here. I just don't want to look like I brought my own. I just want to be that good. Commitment to leadership, cross-sector partnership, and education. And I am going to look because it was education and the communication system. But there's so much work to be done. Coming into this room, I've had various conversations, and more than half these individuals were at some of these sessions. If you weren't at these sessions, then you're on a board. If you're not on a board, then you're a community member. You are at something that is not, if it's not specifically housing, it's so related to housing, and housing comes up in that meeting, and you can't help but to wonder, what are we going to do? We're taking this information and we're learning. It's a continuous learning, but we need champions. Without a doubt. What we've learned is there's so many of us doing so much to pour into the housing system and holding it up that we're not even sure what we're all doing in our own side of towns, in our churches, our lived experience groups. That information needs to be coordinated. And not only does it need to be coordinated, we need to be together and we need to understand, what is your need? What are you good at? What can you help with? What can you call your own? And in that sector, can you be the champion? Can you help lead others with similar missions and visions of your own? And when you find out what you're good at, and even though having those conversations and honest conversations within your organizations, within your boards, within your staff, and then when you find out and says, hey, we are good at all of these things, but I'm going to tell you, we're not good at these. We need to know that information. You're not sharing it with us, because that's not how we communicate. We are in different times. We have never experienced any of this. So we have to work differently. We have to think differently. We have to coordinate differently. So this is our charge to start all of those things. Not saying that we haven't been doing it. We've all been doing it, and that's the problem. We've all been doing it for so long, for so many years, and there are people who work so hard that will never get a microphone, that will never have the ability to be in this room. They are doing this work, and they are tired, and it's getting harder and harder with less funding and less resources. So this gives us a platform to do what the community has asked us to do. And we are trying, and we will succeed. Summit County is good at it. We are. And when we go out to other counties or other municipals or across the country, you always hear our name. May it be through our partnerships, our various partnerships. We get grants, we get opportunities, our youth, infant vitality. But we have to work differently in order to affect these systems in a way that we've never seen. Because we've never seen this. So one of the things that we always say is, I know you are all at these tables. Well, I'm gonna start this, and my heart says start a nonprofit. I'm telling you to look what we already have and let's strengthen what we can. Let's look at our systems. We have a whole bunch of experts. I don't even consider myself an expert, not at housing. There's very few things on this earth I wouldn't even say I'm an expert at. Unfortunately, I was a case manager at Job and Family for years. What I do know is SNAP. And I would be amiss not to even bring that up right now of what is happening. And those are the same. If we did maps, and we have maps, and they've been we're putting that information. It's on the county website. It's on our partner's website, the food stamp website, and they all match what Dave showed us. They match. These are the same individuals with the same hardships. So if we don't start actually doing something, and when you saw it on the news, because I know the crowd that I'm speaking to, your first inkling was, what can I do? The food bank needs your help. Your local pantries need your help. Your neighbors, your elderly, your children, they all need your help. Now, I'm no expert again. I'm not going to sit here and tell you how you can help. But it's better to do something than just talk about it.
Thank you. Appreciate that very much. In the Housing Research Collaborative, we saw consistent. Yes? We still have all of our panelists, but go ahead.
What I wanted to say is that the demographics on the maps and the charts that have been shown, we have already entered into another crisis. With all that's going on, and this thing about food stamps, and people not getting paid, my concern is, what are we going to do? And on this sheet it talks about homelessness. There's going to be more homelessness from people who used to have a job, but they no longer have a job, or the people that are already living in homes, rented, mortgage, or what have you, or AMHA. What happens when they don't have any money? What's going to happen to those people? That's my concern amidst everything else. Are they going to be thrown out to the street? Especially people that are AMHA. What can we do to make this work for people? Because there are a lot of people that used to have a job and never thought they would have to worry about welfare, and they just at a bad time because they ain't getting none, because they're cutting off the food stamps and everything. So this is my concern with all the demographics, all this that's being shown. We are in a crisis now. What are we going to do about the people that are going to become homeless because they don't have money to pay their rent, pay their mortgage, or whatever else.
All right.
What are we going to do?
Let's give that opportunity. Go ahead, Herman, thank
Well,
you.
certainly, I can speak on behalf of AMHA, and your concerns are valid, no question about that. And we have funding for our public housing program through November, for our Section 8 voucher, housing choice voucher program through December. So we're working on a contingency plan just in case we do not receive federal funding in December for our low-income public housing program. But we do have reserves in place to cover the cost for us to continue to provide housing for residents of the public housing program. Certainly, you should be concerned, we all should be concerned, but we are here to meet our residents' needs and to try to do whatever we can to make sure that they're not negatively impacted. And so we're doing everything we can with what we have.
And this is a multiple sector, multiple partnership approach, right? And can I have a show of hands for all of our nonprofits working in the housing space that are here today? They're all going to be here ready. They have been ready. They have been doing the work. So quickly, we can all talk to each one of you guys, and you guys all do work that is to serve that community, right? When we need it the most. Jeff, you're also the executive director of Family Promise. What are you seeing right now in terms of the families that are requesting help for housing?
Well, the biggest issue for the families is living wage jobs. That's the biggest issue across the board. There's no other way to say it. That's why we created the program that we created, the Survive to Thrive Destination Home Ownership Program. It's a program where we, Family Promise, are buying homes. We hold the mortgage, and we work with the families on a land contract to purchase the home. We were so concerned about land contracts because we heard horror stories all across the board on those, that we went to Community Legal Aid and we asked them, would you draft us a land contract that, number one, protects the family, but also needs to protect Family Promise. The way this program works, just to give you a quick example, is there's no debt to Family Promise. We have zero debt. We buy the house, we hold the deed to the house, we work with the family. All the families have to go through the Financial Literacy Center, which is a great program and has been unbelievably beneficial to the families. Because you have to remember, a lot of the families that we deal with, not just us but other agencies, they've never had anybody sit down and explain to them a budget. It's just not been something that's been a part of their lives. That's where the Financial Literacy Center comes into play. But we've couched this program as a mission mutual approach. So there's no way I could have created a construction company to do the renovation on the houses that we're doing. So we partner with Perry Clark and his folks at Truly Reaching You at Tri. It's a mission mutual approach. He needs houses to train. We need their expertise to renovate the houses. We work with Habitat for Humanity. We sat down with Rochelle Civil when we started this, and we asked her, hey, are we copying you with this initiative? Because we don't want to do that. Her response was no. She said, because we build houses, you guys are renovating houses, how about you make it a part of the program that all the families have to come through our 8-week home maintenance program? Because again, many of our families never had to deal with maintenance in the home. So how do you deal with those things and address them before they become big ticket repair items? So that's a great partnership. EANDC provides HUD counselors to our homeowner counseling to our members. They need folks that they need to be in front of, and we need their service. So the way the program works is the family is selected by an independent selection group. Nobody from our board, none of my staff, myself. We didn't want it to be a, hey, Jeff knew somebody, so we gave him a house. We didn't want that. We wanted it to be very transparent. It's a group of 3 people. One was a former individual that was homeless. One is a housing expert, and the other is a social service person. They get the applications, they select the house, or select the family. The family comes to the house, they live in it for 12 months, they rent it from us to make sure it works for them, that they like it. If they like it, we move them to a land contract. We don't have to make a profit on these houses. That's not what we're in this mission for. Give you an example. The first house we did, we bought from the Summit County Land Bank, paid $9,700 for it, and it looked like $9,700, believe me. It appraised independently at $135,000. We're selling that house to the family for $108,000. So start doing the math. They automatically, out of the gate, this is a family that came to us homeless. They were with us about 60 days. They got themselves in a really strong position. Both mother and father are working, have great jobs. So their credit rating is going up. But now, 12 months from now, under the land contract, when they sit down with a lending institution to get a conventional loan, here's what they bring to the table. They bring equity piece to the table. It takes the PMI off the table. Their credit rating goes up every time they make a payment on that house, so their credit rating's gone up. We can provide, at that point, it'll be 24-month payment schedule, so the bank sees that they're a reliable candidate for a conventional home loan. And they're paying down the purchase price of what they're going to sit down and ask the bank for the minute they start their land contract. So it's that kind of creativity that's going to get us through this hurdle. Now, believe me, we are not flush with cash as an organization, but we raise the money for the house, we buy the house, the family buys it from us, the sale of that house then pays for the next house. So it self-perpetuates itself going forward. If we can get up to 25 homes, this program will be self-sustaining. But the reason it works is because we took a mission mutual approach to doing it. Instead of buying all of this extra baggage that we can't afford, and being able to link with people who are good at what they do, it's a win-win situation. Herman and his folks at AMHA found a house in their inventory that they're going to take off of their inventory. It's a great house for us. We'll get the house from HUD, we'll renovate it, we'll put a family in that house. We're 5 for 5 right now. 5 houses purchased, 5 families in them, 5 families doing extremely well. Now think about this for a second. These people came to us in a homeless situation. No bank would sit down with them and give them an opportunity. So let's say they're 6 months into their land contract and the bottom falls out. One of the breadwinners loses their job or gets injured on the job and can't work. Well, if you can't work, you can't pay your mortgage. No harm, no foul to us. We'll just take that and put it on the end of the land contract so the family doesn't lose the momentum they've gained in that process. Now, for you capitalists out there in the room, you probably think I'm a knucklehead, but I don't care. I honestly don't care, because Family Promise will lose $500 per house. When it all pencils out at the end, we'll lose $500 a house. That's our contribution directly to the family, over and above everything that we've done. But I do want to say, because one of the questions was, if there was an infrastructure thing that you could change, what would it be? I would love to see, and Latoya hit on it, this community is rich with organizations that are doing extraordinary work. Zach Cole and the work that's going on at the well, Rochelle Scipio and the homes that they're providing, EANDC, AMHA with what they're starting to work on with us in doing what they're doing. We have the solution to make the needle move when it comes to affordable housing. What we don't have are the funding resources to make that happen. So if we could do an infrastructure change and direct dollars to programs like ours, like Zach's, that kind of a thing, we don't have to reinvent the wheel. It's already here. And there are other organizations in the community that are doing great things with housing. So rather than try to do another study, sit around talking about it, you can tell by the color of my hair I'm tired of studying. I want shovels going in the ground. I want to see people actually moving forward and getting out of that situation of homelessness, because I will tell you, I don't care. I'm not a doctor, and Latoya, I'm not an expert on anything. Ask my wife. So if you look at what a home means to somebody who is homeless,
Just stop a minute. Think about what it means to you. You drive home, you go into your home at the end of the day. What does that mean to you? You're safe, you're warm, you're dry, your family's thriving. Why can't other people have that? It's doable, you guys. It's very doable. And so I'll finish by saying that, real quick synopsis to drive it home. That first home that we gave, not gave, they're buying it, made available to this family. It was a family of 4, mom, dad, and 2 little girls. Mom was pregnant with the 3rd child. The day we moved him into that house, staff and volunteers moved him into the house, mom had to go to the hospital because the baby was on its way. She was pregnant with her 3rd child. When that child was born, instead of coming back to a shelter or coming back to a car parked in the back parking lot, they came home to a house. They came home to a house. And the way we do it is we have the case manager that works with the family present the key to the family to kind of bring that closure to the work that they've done and help that family grow. I'm telling you, the father of this family was as big as I am, but had me probably by 30, 40 pounds. Big man. Proud father. She handed him the keys and said, "Welcome home, James." That man sobbed like a baby.
Yeah.
Sobbed like a baby. And the other tall guy got in his truck and drove back to the office, and I cried like a baby. Because it was one of the most beautiful experiences that you could possibly experience. I'm sure Zach has had it. I'm sure Rochelle's had it. I'm sure Herman has had it with the good work that AMHA does. The only problem with AMHA is Herman has to deal with HUD. If that was out of the equation, get out of his way. But the point is, you guys, as a community, we are on our own. And if you don't understand that now, given what happened during COVID, and given what is happening right now, then I'm just going to say it flat out, you're asleep. You're not paying attention to what's happening. We have the answer. The answer is we all put down the silos, look at the inventory that's out there, and make it work collectively. Change that infrastructure, and we can address this. My reason for telling you about that father is that went to his mental health. Physical health is an issue with homelessness, but mental health. Here's a man and a mother who can give their family a home and a shot at a good life. They've got a backyard they can play in. They've got a home they can bring their buddies over for a sleepover. They can do homework at the kitchen table. You guys, that's what it's all about. And I know I'm on a soapbox, but I'm going to drive this point home till they tell me to go away. But the point is, the solutions are there. What this initiative that Eileen and Patrick put together just proved that the resources are out there. So the call from this table to all of you is, help us do what we're doing. We need you, we can't do it without you, and there are solutions.
Thank you, Jeff. We'll grab. Andrew, one of the consistent themes that showed up also in the Housing Research Collaborative was that housing-related crises are often caused by other crises. In your work at Community Legal Aid, what are some of the most common legal issues that people face when it comes to staying housed?
That's a good question.
Thanks, I have a whole list of them.
And that's been answered by some of the other panelists up here. In part, that it starts when people are trying to move in. The barriers to becoming housed and finding that rental unit, house, or an apartment are significant. Obviously, MHA would love to have more units on the market, but they have a budget there. People who have had an eviction filing previously are going to have that come up, and any landlord who's looking at the court records is going to look for the tenant who doesn't have that eviction filing, even if that was a baseless filing by the landlord. So not having a sealing process that automatically seals evictions when they're dismissed, or doesn't have them on their record unless there's a judgment, can affect people. The costs associated with housing, not just rent, but rental application fees, and paying $50 or $75 every time you talk to a landlord so they can run that background check or just process that paper application. can be insurmountable for a lot of families. Once the families move in, we've talked about condition issues a lot. There are about 75,000 tenant-occupied units in Summit County, and about 20% of those are from 1939 or before. So we're talking about Great Depression era or older. Another 15%, so another 11,000 are from 1959 or before. So we're talking about the Eisenhower administration or before. So right there you have 35% of the rental units in Summit County are from when Eisenhower was president. It just seems very, I'm not young, but that seems like a long time. It was before I was born, a few years. And you think about all the things that go on when houses age. You know, the wiring is bad. The heat system just isn't as good. The ductwork isn't as good. The pipes aren't as good. All of those things are coming up and up and up. And it affects tenants. And there are laws out there that allow tenants to do things like escrow their rent when there are conditions issues that come up, but they are difficult to deal with. We have a grant right now through the Akron Community Foundation to work on the escrow process with our courts to make it easier for tenants and just more user-friendly and easier for courts to navigate as well. But there's one escrow case filed in Summit County for every 120 evictions filed. And from our work, we know that pretty much anyone who's come in through our door, even if it's non-payment of rent, the eviction has nothing to do with the conditions issues. There are conditions issues there. So they're present in so many of our rental units. The legal issues that people face when it comes to being housed, just who you are. Having children makes you twice as likely to be to face eviction or to be evicted. If you don't have children, it's about a 1 in 20 chance that you'll have an eviction filed against you. This is nationwide. But if you have children, it's 1 in 10. Children represent 40% of all people who are affected by evictions in any given year. So just who you are. You know, black women are way more likely to face eviction than white men or white women. It's kind of baked into the system, and we need to figure out ways to overcome those barriers that exist. And those maps that David showed match up with the redlining that's been going on for decades and decades, or went on for decades and decades, and we're still living with the effects.
Thank you.
So all those things are legal issues that people face when they're getting into the rental market.
And to repeat the data point that you shared about how likely you are to be evicted if you have children.
You're twice as likely to be evicted. So we can blame our kids for not having clean rooms, and it's not their fault that you're going through that process. But it's just a part of that because of the expenses and all the things that go on with having children.
So Jada, you work with those kids.
So,
Tell us more about it.
So can everyone hear me? Yes. All right, cool. So hello everyone, my name is Jada Moore. I'm a youth manager for Summit County Continuum of Care. First off, as a COC, our two main objectives are to monitor and manage all of the federal homelessness dollars that Summit County and Marvinton receives from HUD. Yes. If we did not have to work with HUD, it would be a lot easier, a lot less red tape. But that is where we receive a lot of our funds from, and I'm very grateful for that. But also we are responsible for managing the crisis response system. I see a lot of our COC funded partners like AMHA, Family Promise, Hope and Healing's up here. I know United Way's back there, and Shelter Care, I think, because I see you in here, Jess. And anybody I've missed, I'm sorry for missing you. But as a crisis response system, we are doing a lot of work. I am always honored to be able to work with our youth and young adults. When we talk about youth, HUD considers youth 24 and under. So I'm talking about children all the way up to 24-year-olds, and I'm 30. So a lot of them call me Miss Jada, and I'm exactly right with them. I am teaching young adults who never had their parents or their loved ones. 40% of our homeless youth aged out of foster care. 40% of them also identify as LGBTQIA+, a part of that population. 50% of Summit County's homeless population that does utilize resources identifies as Black or African American. If I'm sure I'm correct, Black people make up 14% of this county. Numbers are staggering. 211, who is the first and only access point to go ahead and get screened for every COC-funded homeless program in our county, is receiving an average of 2,300 calls, housing calls a month. Whether you're homeless, looking for shelter, need assistance with rent or utilities, that's 2,300 calls a month, That's about 157 new inquiries a month. That is a lot of work. So I'm working with APS, I work with Child Protective Services, because APS, they are our McKinney-Vento liaisons. That grant is specifically for unaccompanied minors, 17 and under, who are still in school. That grant allows those youth to be able to still go to the school that they already attend, that they feel safe to go ahead and continue to get tutoring and to see those teachers and those classmates that make them safe. Myself and our youth advisory board, who I'm always honored to work with a group of youth and young adults, 24 and under, 2/3 of them have the lived experience of being homeless in Summit County, being doubled up, which is the main cause of homelessness for youth and young adults. So it's been labeled a lot of different things, multi-generational homes, who's ever lived with their family, but you also have your aunt and uncle living with you too, or your grandmother. That's considered doubled up. That is category 2 homeless. Because of the efforts of myself and our youth advisory board, we are around 7 sub-recipients for YHDP funds, Youth Homelessness Demonstration Funds, where we were awarded $1.46 million for youth homelessness specifically. Youth homelessness. Our YAB was fully involved in that. They helped write the grant. They chose the applicants who were, they interviewed everybody. Latoya was there, thank you as a board member, but helping them ask the question, because a lot of them were in these programs. They've been through the system. So giving them the ability and agency to make changes in the system that they were once a part of. They were also awarded Youth Homelessness System Improvement Funds last year as well. So that's another $166,000. They're creating programs to identify gaps. They've already identified a lot of the gaps from their personal experiences, surveys, and everything else. But what it looks like now, it's not what you think. It's not street homelessness. If you don't have a key or your name is not on the lease, you're category 2 homeless. That's the reality of it. The reality of it, to answer that lady's question up there, reality of it, if you call 211 right now, you do your homeless intake, there's not a guarantee for a bed for you. And that's where we are. Now, we are all doing great things, but we can all be more collaborative in doing these great things, especially since funds are scarce. Me, for example, which YHDP funds, which we unfortunately do have a wait list for, I can serve category 2 youth homeless. So if, Jeff were to have a youth or young adult who may have qualified for our program, they would be able to go ahead and join that program. Also, we compensate our youth. Every YAB member makes $21 an hour for their time. So whether you show up to our in-person meeting, that's at the SOS Drop-In Center at 5 o'clock, where we teach today's life skill lesson is trick or treat yourself, because again, we are teaching youth and young adults who did not have support systems. So it may seem crazy to y'all, but my dad is back there recording, being a proud father, but I have the luxury of my dad teaching me how to drive, how to do a bicycle kick, which I can't do now, but in my prime, I was very good at. But it's those things, and I'm very appreciative that I had that opportunity with both of my parents being present in my life. So now that I'm working with these youth and young adults who did not have those opportunities, it's very much so about making sure that we have the resources available. All these maps over here that you saw back there, in those nice, beautiful homeless reports, but it's the same thing. That's where we have a great concentration of homelessness. And for those of you who, I don't want to take up too much more time, please reach out to me if you do want to work with our homeless youth. There are many programs that they're working on, but they also need mentors. I can't do everything myself. We want to make sure that everything we do with the youth, we're exposing them to. If you don't see it, you don't believe it. Our two main things are telling our youth that we love them, teaching them responsibility and accountability.
Thanks, Jada. Herman, wrapping almost this up a little bit before we move to the general questions for you guys. What role does public housing play in supporting long-term health and well-being for individuals and families?
Well, we support more than just long-term health. It's really short-term health as well, because when we house a family, we house them in a decent, safe, and sanitary place, and it's called their home. You know, AMHA is the largest landlord in Summit County. We serve 25,000 individuals, and between our Housing Choice Voucher Program and Public Housing Program, we have a myriad of services and programs available for self-sufficiency programs. We have service coordinators who meet the needs of our residents and try to link them with services in every development that we own and manage. So it's important, to AMHA that every home is led safe. So all of our homes, all of the homes that the units that we own and manage are led safe. So that's, one of those long-term health, items that obviously was important to us that we were able to address many years ago. And so we try to meet the needs of all of our residents. We partnered with the city of Akron and others to launch this summer the Summit Metro mobile market. And so that mobile market goes to many of our buildings, and residents are able to purchase groceries on the
The food truck.
food truck,
Yes.
right, food truck. And I think that's an excellent way to eliminate the food desert and concerns that we have, in our community. And so we've been around for 87 years, and we're looking for ways to improve and get better. We're also looking for ways to expand the number of public housing units that we have. And also, one of the biggest focuses of AMH at this point is really to preserve what we have. 70% of our units are located in the city of Akron, so it's heavily concentrated in Akron. We have a development in Twinsburg, we have a high-rise in Stowe, and some units in Barberton and Cuyahoga Falls. So we're only located in those 5 communities when it comes to low-income public housing. And I think at some point we're going to have to address this issue of people who live in certain areas not wanting those people in my neighborhood. And that's maybe a separate conversation we need to have, because we want to be very ambitious, but we understand that we're going to face a lot of opposition if we decide to go, to build in certain communities. And we certainly don't want to, we certainly want to move forward with, expanding the number of units we have. But obviously we're going to face a lot of opposition, and we're going to need some help to hopefully break down whatever barriers that we may have in pursuing that. So obviously that's going to have to be a different conversation, because we need support of those other communities if we're going to deal with this affordable housing crisis. And we can't just really focus on all of the units being or the vast majority being in the city of Akron. So
I'm hoping we can have a discussion about that in the future.
We're happy to host one if you need our help. So for the full panel, please, housing is framed as a commodity usually, right? As something that you can get it if you can afford it. So what changes when we start seeing housing as a basic need, kind of like clean water or healthcare? Go ahead, yeah, go ahead. Anybody can take it. We'll go with Jeff first and then Jada.
Well, I think the important thing that immediately changes, and then you would see it immediately if more people were homeowners. And again, not everybody wants to be a homeowner, but for those who really strive to do that, a lot of problems will fall off the table. Neighborhoods will be strong, schools will be strong, folks will want to be engaged in community activities because they have a part of it. They're a part of it. It's not just a transient rental kind of a scenario for them. They actually own a piece of the community. That's really, really important. The term I always use is, who washes the rental car? When you rent a car, do you wash it before you take it back? Nope. But if you own your car, you take care of it. So it's no different with a house. And when we can get to the point where home ownership is not this mountain that nobody can climb, but we kind of level the playing field as best we can with as many different opportunities as we can put out there, then I think what you'll see is not just the health, physical health and mental health of the folks that are in the home go up, but I think you'll see the pride and the support of the community grow as well, because now we've got folks that want to be here with us, and we want to work with them, and we want to educate our children well. We want them to have good jobs. We want to have a clean and prosperous city and community, and that automatically will go up. And I can tell you from an actual real life scenario, the house that we bought on Archwood was on a corner. And as I said, it looked like something right out of a horror movie scene when we got it. Ivy was growing into the bathroom in the house. But once we got the house cleaned up, neighbors down the street, they were doing things to their houses. They were putting a new fresh coat of paint on. They were landscaping. They were, because they felt good about what was happening to their community.
Inman got paved.
Yeah, Inman got paved.
Yeah, where did that
I would love to take credit for that, but I can't.
Go ahead, Jada.
To add to Jeff's point, home ownership is great, but addressing housing in general starts to address the trauma of homelessness that it is, first and foremost, because realistically, I'm not going to say everybody, but mostly everyone knows where they're going after this. On a scale of a parent, if you have, because most of our homeless population does work all the time. They all have jobs. So if you're worrying about where you guys are going to sleep, how you're going to feed your kids, and everything like that, that does affect the mental health, the physical health, the emotional and social emotional health of yourself, but also your children as well. Because I know a lot of great parents who you're trying to shield yourself from everything, the kids see it. So the kids are going through trauma. So what it looks like in school, if my fourth grader is always sleeping in class, well, this may be the only place that they feel safe to sleep. So when we start treating housing as human necessity and human rights, that gives everyone, you can start addressing the trauma from children, family, and then more wraparound services. Then we start to act more of a community. Because when that happens in all of our COC programs, for example, I'm going to highlight Harmony House, who they're not here, but they are one of our sub-recipients for our joint transitional and rapid rehousing programs. They have short-term goals. You have to address the trauma. Okay, so hey, you're gonna live in this shared living space. You don't have to pay rent for a year, but there are goals. What is important to you? You want to get your GED. Okay, let's start addressing that. You want to address your mental health. So that way, the community starts to take care of itself, honestly, if we start to think of it in that way.
And although, we prioritize housing homeless families, we have over 26,000 people on the waiting list. And so if you are homeless, you do rise to the top of the list, but again, you're rising to the top of the list of homeless people who are already on the list. And so you can be housed maybe in 6 months, maybe a year, depending on the bedroom size. So the issue of housing availability, affordable housing availability, if you will, is dire as far as I'm concerned. In our world, we feel that, or we go by this 30% of your adjusted gross income. So we can't just arbitrarily raise a person's rent. It's really based on income, as everyone knows. But it's a dire situation. We need to continue to have these discussions and come up with a plan to address these issues, because it is sad to see someone homeless, as we all know, and we've got to come up with a plan to address these issues. And I think one of the things we really need to focus on is preserving the units that we currently have through programs like Jeff's and other programs in the community, like the well, and so on and so forth. Rehabbing those properties and making them available, because this costs much more money to build a new single-family unit, whether it's a part of a building or whether it's just a single-family dwelling. It costs a lot more money just to build. So we need to try to save the homes that we have, rehab them, and put them back into use. So
I would also like to add, COC in 2023, we did have the funds. We had a landlord mitigation program. And with that paid a 3-month deposit to those landlords who understand that these individuals that we are asking you to house may come with some extras. There may be some difficulty. All we ask you is you contact us so we can make sure their case manager, because all of our COC programs have wraparound services included with them, that their case manager can address those said issues. And if those issues if we cannot come to a compromise, then we will go ahead and get that program participant out of that unit and get you someone else. But what that program really did in those relationships that we have with those landlords, we changed that view of being a landlord into a housing provider. That makes you very much so more human, because we do live in a capitalistic society, but it's a room full of service providers in here. You looking at these individuals that we are working with as humans has worked tremendously. We don't have the funds for the landlord mitigation program anymore, but those relationships that we have had and maintained with those landlords has gone a long way. So bringing different landlords into these conversations whenever you do have that conversation, Christina, about housing and how important, and when you start talking about evictions and everything like that, those landlords need to be at the table as well.
Thank you. So, you got something else to go for it?
We've done this before, and we've succeeded. When the pandemic hit, we all followed those instructions. You didn't see cars, everybody hunkered down. We did what we were supposed to do. We did what we were told to do. We supported each other. We formed new bonds, new relationships. Right, exactly. We need to realize we're here again. It may not be COVID, but we are in a pandemic. And the problem is some people are going to get sicker faster because they're low income, because of the zip code they live in, because of generational poverty. This doesn't affect our whole community the same way, but it will affect our whole community in a different way. And that's what we have to understand. Those that are not immediately impacted are still related to this problem, these situations. May it be food insecurity, shelter insecurity, health insecurity. It's not stable. We don't have a stable community because the problems is saturating our resources. We have the right people here in Summit County and even in this room, and they've been doing the work. And you heard Jeff, and you heard Jada, and you heard her. They're doing the work, but they can't keep up with the demand. So the question is, those that have not been at the table, those that have not volunteered, those organizations that have not been collaborative, those businesses who have not shown their philanthropy, where are they? Because we have GAR Foundation and we have ACF, and they're always here to open and listen and work with anybody and work so well with the community. If it's not monetary, they will point you in the right direction where you can donate, where you can give, where you can help, and they will put you in contact with the right individual to support any kind of help that you can give. But until we realize that this is not just a them problem, maybe any of these inconsistencies and these insecurities, but a us problem as a community as a whole, then we can start making systemic changes.
Thank you. Let's make it double so we can thank the entire panel before we open the questions. All right, so let's go ahead and open up for question. Chris is going to help us out over here. Chris, to your left.
Hello. My question is for Jeff, and I want to present a question for consideration, and I think that it also overlaps over to Herman as well too. Now it could be I'm oversimplifying this. If you know me, know I'm a bold visionary. But it seems to me, so here's my question for consideration. If smaller organizations with less capacity, like mine, for example, who are passionate about housing, who do provide safe housing in a very limited capacity, partnered with you, say we had a line item on our budget, we had $10,000. Could it be that if like 10 of us took that $10,000 and partnered with you to purchase a property like that initial one you did for $9,000, and we initiated that process, wouldn't that be a quicker way or a fast way to increase the capacity of this program through partnership? Because we may not have $25,000 or $30,000 to invest in seeing the project through end, but we may be able to, come up with, raise, or allocate that initial seed, and then we already have program participants that can go into that housing, or it moves your program participants along the line so that more can come into that model. I love this model because it's passionate. It's passion for me because it talks about that whole life wellness situation, and then how it overlaps into increasing the capacity at AMHA. Instead of just building more units, that we put more families in that make them dependent on the system that keeps the waiting list so long. What if you worked in partnership with this program and we were able to increase the capacity of the homes available? Wouldn't it, one, diversify where we put these families? Like you said, you want to spread out the allocation of the houses or housing. And two, wouldn't it get more families with that buy-in to their community if they moved more into this type of model that's already similar to the choice voucher programming? So we're increasing capacity, we're getting program members buy-in into their housing, and we're diversifying the allocation of the capacity we're building.
All right,
I
thanks.
know it seems simple, but
Let's
could
see.
it be? Yeah.
Thank you. Yeah, go ahead.
No, it's simple, and thank you for your passion. That's wonderful. I will tell you that we're already doing that with MHA to a degree. For example, this first family, they were getting subsidized pay for their rent, and as they worked through, got stronger, you know how the formula works, then they don't get as much. Once they show increase in their earnings, that kind of thing, they graduated off, and they are soaring on their own. So that program is very beneficial to the families, because you can't just say to somebody, hey, you want to own a house? There's a process, obviously, to go through, and they got to feel comfortable. But I love what you said, though, about what happens with this is families now can start their generational wealth, so that they become as strong as they possibly can be going forward. One of the houses that I mentioned earlier, through a program that HUD is doing with the local authorities, we'll be getting a house from them, we'll renovate it, and so that's a feeder for the houses. But absolutely, any organization that wants to do a partnership like that, we encourage that. We're doing it with Family Promise guests, but we're moving into now working with Direction Home, because believe it or not, there's a senior population that's facing homelessness. So we're working with Abby Morgan and her folks, and we're also the next house that we get, we're gonna work with Asia Inc. On that, because they have folks in their program that are facing homelessness. So yes, the answer to that question is absolutely yes, because that helps with the whole equation of getting people together. That and CRA dollars with the banks are very important.
The majority of the AMHA population, or probably about 55, 60%, are on fixed incomes. And so we have a certain population who probably will never, ever be able to own a home. We do have able-bodied residents who work every day, and so that program will be more, for them. I believe, Jeff, you kind of focused on the homeless population, correct? So the people that we serve, the residents that we serve, are not homeless, obviously, but we do have self-sufficiency programs where they can build an escrow account, and in some cases, I earn $30,000 to $40,000 and use that as a down payment, or to pay off debt, or to pay for education. So again, I think that it's twofold, or maybe threefold. I don't think it's just one answer. I think there's multiple ways to attack this particular issue. My only concern is production. How quickly can we get this done? I mean, we can't, Jeff's doing an excellent job housing homeless families, but we need more housing, like soon, not in 10 years, like really within the next 3 to 5 years, or sooner. We need housing. So we got to figure out a way. How do we quickly produce the number of housing units that we need to really make a significant impact? So.
Thank you, Herb. Next question, back there, please.
Hi, Lisa Mansfield, Vantage Aging. We also do Meals on Wheels in Summit County. I knew I could count on my friend Jeff Wilhite to bring up our senior citizens in our community. As we know, about 30% of Summit County will be over the age of 65 by the year 2030. So I just want to throw out there that we can't forget about our seniors. Summit County's trying to do a really good job with aging in place. There are other things, AMHA has senior housing, but our seniors are at risk, very high risk right now of becoming homeless. So it's a population, not discounting families. Families are incredibly important. Multi-generational families are incredibly important, but we can't forget our seniors as well.
Right here? Yeah. I could probably be loud enough.
Oh, he's right here. Yeah, there we
As
go.
everybody knows. And actually, my question is for LaToya about
thanks, Christina.
loud people band together. Can you hear me now?
Sorry.
No, that's all right. All right. LaToya, is there a plan from the commission, to get everyone together, that, everybody in this room that works in an organization that deals with housing, is there a plan to get everyone together so that we can map something out and actually tackle the problem?
Oh yeah, there's definitely a plan.
And if we didn't have a plan has been forced on us because of the situation that we're in and we're facing. Did you hear me?
Again,
Look, some in the back says yes.
yes.
Again, yes. We are devising a plan. We don't need to build anything brand new. We already have individuals in this system and organizations. The Summit County Continuum of Care is a backbone organization of homelessness. We need to pour resources into organizations like that. We need to pour our focus into what we have. But yes, what we have not done is call our faith-based community and had them and convene them together and ask them, because it's a whole underground system of help and support that's been going on that hasn't had an opportunity to speak out, that hasn't had an opportunity to come to the table, that hasn't had an opportunity to be organized, or we haven't had an opportunity to reach out to them and actually help. And I'm going to tell you the problem. Well, one of the major problems is because like many of basic need systems, and I put on my Bridges Out of Poverty hat, we function in the tyranny of the moment. Our shelters are to capacity. We have waiting lists now. We know this is about to get worse. In order to do that again, we have to talk to individuals that haven't been at these tables, are willing to listen, are willing to support and help any way that they can. And we who make the tables, who are sitting at the tables, who are head of the tables or convening these tables, have to be willing to listen to these individuals also. Because we need something new and different in order to combat what we face. So yes, right now, some of our partners from the steering committee, from the research collaborative, we were initiated into a cohort through the Furman Center, that's NYU. They picked small to moderate government agencies, may they be county or city throughout the nation. Right now in this collaborative, it is Summit County, I believe it is York County, PA, and Baton Rouge, Louisiana. We are collaborating with them to figure out the best practices of what communities have done in facing not just homelessness, but zoning and redlining and a lot of these other things that historically has put individuals where they are now in these situations. So we are working not just within our community in Summit County, but we are working outside, nationally to bring those resources and help and any kind of funding and opportunities and encouraging our partners to also do the same to bring that information to the table. But yes, the county is committed to convening these individuals and having these hard conversations to really sort out and solve some of these major issues. And thank you for asking.
Thank you. All right, we have room for 2 more questions, so focus on the question. Go ahead, yes.
I was wondering why, I'd like to hear how the city of Akron is partnering in this issue. I can understand that at the table. All you're going to do is drive around this city and see the challenges with housing and the lack of it, affordable, and how many people waiting in shelter. So what's the collaboration with the city on this? I understand this is a Summit County issue, but they're a big player in this, so what's up with that?
The city of Akron is always at our tables helping and always willing to partner with us. Personally, side by side, we've worked with Helen Toman at the city. She is also a member of the COC board and actually one of the original founders of the Continuum of Care. Co-collaboratives. Yeah.
We are co-recipients for some of the grants here in the city. Okay.
She said, now you want to hand it to me.
Okay, so since you did mention the city, like Latoya said, we do work with Helen Tomic. Helen Tomic works with us with all of the homelessness issues regarding the city. So she's on our board. So the city is very much so involved. Latoya did mention our strategic plan, which you can find on summitcoc.org. We collaborated with the city for that plan and a lot of different community partners, and that's going to be our guide on how we are going to address homelessness here in Summit County. We also have, if you go to summityab.org as well, you can find the Youth Advisory Board's coordinated community plan on how they plan to address homelessness as well. Okay.
And it's not just that one department in the city. They come to the table for various reasons, for various topics. I can applaud, and I can't remember his name, and I feel bad right now. Our lived experience, Matt? No, not Matt. Our lived experience committee actually wanted to talk to one of the Akron police officers. And he actually came to talk to our lived experience committee through the COC. So the city has been there, and not just the city of Akron, Cuyahoga Falls, Barberton is at our table. And we are always in conversation, and I have a call out to Mayor Adamson in New Franklin right now. We are, again, until we understand that this is not just one city's problem, but all of our problem as a community and as a county at whole, we're not going to get through this. But yes, all of those communities are at the table, and they are constant advocates in this struggle. But thank you for asking.
Thank you. Well, thank you everybody for attending. Thank you to our panelists for lending your expertise, your knowledge. We are at time, and we look forward to seeing you at our next one, which will likely be in February or January. You know, we're a little flex these days. Please take care of yourself. Dia de los Muertos is coming, so do me a favor, remember your loved ones who have departed and honor their memory, and in that honor them with action as well. I'd like to thank again our board members for attending, our community investment team for helping put this together, our panelists, and have a great day. You have about 15 minutes before we start kicking you out to mingle and network. Thank you so much, everyone.